You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And happy to see you, happy to share with you, happy to explore other areas of healthcare, health maintenance, and just well-being and longevity. There's nothing wrong with that. And with the conditions that we're looking around us, with cancer, with degenerative disease, with strokes and heart attacks and all those things, you have to wonder, do we have to live with this? Is there anything we can change? And yes, there are a lot of things that you have within your reach, that you have in your own hands, that can be changed for better, for the betterment of your life and the lives of those around you, if you just spread the word. So not only this blog is important, but it's very important what you're going to do with it. And I'd love if you share it with other people, if you review it with other people, if you examine and reflect on some of the concepts. And I might be wrong. I accept that. But at least give me the opportunity to think about it, to reflect on the things that we're analyzing. Today I'm going to be talking about a very important disease. Very important. I'm going to talk about lung cancer. Lung cancer is one of the most deadliest cancers in America. We have a lot of people. It's probably the most frequent cancer in America. And with that, it brings a lot of despair and suffering and deaths. So we're looking at a condition that's not an easy thing. It's not something we can forget about it. It is something that we see every day. We see it in the news with important people that got lung cancer. We see it with friends, with workers that are around us, etc. And we see all these people getting lung cancer. And that's the bad news. Then comes the next segment of the bad news. Most of these people die. Within a short period of time, we're going to lose them. They're going to be gone. And once again, my question is, do we have to live with this? Is there anything we can do? And let me give you some important figures. When we develop cancer, specifically speaking, lung cancer, you have more than half, you have like 60% chances of making it to the 5-year rule that in cancer survival is like the golden rule. You have 60% chances of overcoming the cancer for those 5 years if the cancer is discovered when it is localized. What's that mean? Well, it means that a cancer normally starts in an organ. In this case, lung cancer starts in the lung. And it starts like a very tiny little tumor that just creates a little bit of a problem and then begins to grow and create an image. And I say an image because there's going to be a point where you can see it on an X-ray, on a simple X-ray, on a very inexpensive X-ray. You can see it and you can say, aha, there's something. Then another studies are done, a biopsy might be taken, and then we say this is a lung cancer, let's attack it. And your doctors are going to give you a huge possibility of survival of that cancer if you detected it early. But you know how many people actually detect it in that stage? Of 100 people with lung cancer, only 25 people can detect it when the tumor begins in one area. And that's what we call a localized tumor. So when the tumor is completely local to one part of your lung, you can only do it in 1/4 of the cases. Out of 100 people, 25 will discover it at that stage. Then the tumors begins to grow and starts getting to neighboring tissues. It starts attacking other parts of the lung, other parts of the bronchial tree, and it starts to spread. But still it's in the lung. It's still within the lung. How many people can tell, I have a lung cancer, but still it's in the lung, it hasn't gone anywhere else? Another 25%. Still very low. In both cases, we have a minority of people that can say, I get it localized or I got it just within the lungs. But then the tumor expands and opens up branches, starts creating tumors somewhere else. Lung cancer will go to the bone, will go to the liver, will go to the brain, will go to just about every organ, but those are the most common. And then starts invading, sending distant seeds to create secondary tumors of lung cancer somewhere else in your body, in your liver, in your bones, in your brain. And that stage we call it that the tumor has spread, and those secondary tumors, we call them metastases. Then we say that person has a metastatic lung cancer. You know how many people we discover with metastatic cancer? Half of all them. In other words, 50% of the people we know about lung cancer when it begins to be too late, when we can do a lot less, when whatever we do is going to be more expensive and less efficient. And we lost the opportunity to tell that you had a tumor early on. The difference? When you detect a localized cancer, I already told you, you have 60% chances of making it to the 5th year. When you discover it metastatic cancer, only 7%, 7, will make it to 5 years. And that's after very intensive, very dramatic, very costly therapeutic treatments. So there's a big difference. Now, the question I began this conversation with, do I have to live with this? Can I do anything to change it? Well, the first thing I have to do is I have to detect it very early. I have talked before many times about prevention, which should be our golden key to success. Don't get lung cancer in the first place. And if you follow me, you can go to different conversations like this, to my blog, to my podcasts, and you're going to see everything I tell you about prevention, because yes, it is absolutely possible. But then you say, well, I didn't get to that point. I already have a problem. What do I have to do to catch it early? It's not going to give you any pain. It's not going to give you any symptom. It's not going to give you anything. Like the most deadliest of all diseases, lung cancer is silent until it's very hard, very late. So you do not have to let that happen. So what you have to do, well, let's say you're 40 years old, and we have to start early, because cancer is going down with ages. Used to be an old person's disease, it is not anymore. You see younger and younger people. So let's say I'm 40 years old. I'm healthy, I'm fine, I'm having a fantastic personal life and professional life and traveling and enjoying my life. And I can jump in the doctor's office and say, Doctor, I'd like to check a couple of things. I want to make sure that everything looks okay. Just check it out. Like when you're going on vacation, you take your car just to check the tires, the lubricants, these things. Oh, it's fine, fantastic, your car is beautiful. Okay, great. You live with a little bit of peace of mind. You do the same thing. You go and you say, I need to do this. And you know what? I heard that I should take a chest X-ray, which is going to take me 2 minutes, which is going to be very simple. That's going to be very inexpensive, just to make sure that my lungs look nice and beautiful. And the doctor is going to tell you, yeah, they look beautiful. Go home. Forget about it. And then in about 3 to 5 years, you do it again. But once you get to 50 years old, then start doing it more frequently. Every other year, something like that, and start looking not only for that, check your blood pressure, your sugar level, these things, because if you keep everything in check, if you can be very proactive and vigilant, you're going to catch whatever comes to you as early as possible. Again, the ideal is to prevent it. And please follow me, because that's the most important message, to prevent it. But let's say you have a disease, catch it as early as possible. And you can, because it doesn't take too much. You can go to your doctor, have a friendly conversation, and say, Doctor, I'm fine. I have had people, thank God, I always commend these people that have come to me and say, Doctor, I'm fine, I'm healthy, but I'd like to make sure I'm going to continue to be in that direction, that I'm going to be able to enjoy my life in the future. And that's what I want to tell you about in the first place. Lung cancer is a deadly disease. Make no mistake. It's going to catch you, and it's going to kill you. And yes, there are many risk factors. Smoking, cigarette smoking is probably one of the worst, but there are many other conditions that you don't even know about. There's a gas that we don't see, that we don't hear, that you might not even have heard the name, which is radon. You can go to your city officials and ask them to check for radon in your house or in your work environment and so forth. It can produce lung cancer. So we have to do that. If you send me a note, I will give you an answer to what I'm talking about. But please, let's make sure we catch this early. Let's make sure you stay with me, because I have to say a lot more things about lung cancer today. You're with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And in today's podcast, in today's blog, we're talking about lung cancer. And believe me, this is very important. It's very important for several reasons. The first one is that it's a very frequent cancer. It's one of the deadliest cancers in America. We see more and more people with lung cancer, and we have to take a rational approach against that. We have to make the changes we have to do. And then we have to say, I don't want to suffer with this disease, so can I prevent it? And yes, the first line of defense is don't get cancer in the first place. And that goes with a little analysis of what are my risk factors. A risk factor is something that happens in your life, in your lifestyle, that puts you within the possibility, within the reach of a deadly disease. Let's say diabetes. A risk factor is obesity, because that means you're eating a lot, you're eating wrong things, etc., that puts you in a high risk of being diabetic. And you don't have to be a doctor. You see some people around you and you say, you have to take care of yourself. You're going to be diabetic, or you're going to have a heart attack. You see, so we instinctively know when we are at risk. But with few things, It's difficult to say what is the risk, like in high blood pressure, another silent killer. But with lung cancer, well, we know about cigarette smoking. We all know about cigarette smoking. And it is so important that now it's even banned to smoke in front of any other person, because we know that secondhand smoke also produces cancer. So if you want to smoke, go wherever you're just by yourself. Because if you smoke on the sidewalk, many people smoke in the sidewalk because, well, that's safe. Well, no, it's not safe for anybody. First of all, it's not safe for you if you smoke outdoors, and it's not going to be safe for the people around you, because they're going to get the smoke anyway. It's not a matter of, okay, it's going to be more diluted, but nevertheless, you're going to be smoking it. We saw it with COVID. You were walking on the sidewalk and you could get the disease from somebody just walking by. The same thing happens with cigarette smoke. If you smoke in front of other people, those people, no matter where they are, have a risk factor because of that. But there are other factors, and they have to do a lot with breathing, of course, because we breathe in substances that might not be good for you. There are a lot of chemicals today that we're not even aware of, that we bring them home. Make sure, for example, that if you buy a pillow, it's an absolutely natural pillow. You don't want any chemicals in there. And what I'm talking about is that many times they sell you chemicals with a good excuse. Because they tell you, well, if you buy this pillow, if you buy this mattress, it's fire retardant. And you say, okay, in case of a fire, I'm going to be safer. Think again. Make sure you know what sort of a chemical, because that's the way you make it fire retardant. Make sure what kind of chemicals are in that thing that's going to be next to your face night in, night out, particularly with children. We were having a problem, for example, with sudden death in infants, and all of a sudden we discovered that some of the plastics we use for a baby mattress or for a pillow could be the cause, could be the culprit. So make sure that everything we're breathing is clean. And the best way to do it is by going to natural things. You can use wool, you can use cotton, you can use linen, real linen, and be safer than if you use any sort of chemical thing that's been touted as having this or that possibility or advantage. Yeah, it might be fire retardant, but might be toxic as well. So make sure you know exactly what you're putting next to your face. And lifestyle. Lifestyle is very important because what you eat has to do with lung cancer. If you have a good amount of vitamin C in your diet, if you have a good amount of beta-carotenes and all those good things, magnesium, potassium, etc., which all are in vegetables, not in meat, then we are going to be preventing, we're going to be in better shape. So analyze, review, think of all these things. I'm not telling you to be a vegetarian, but yes, I'm telling you that at least 50% of your calories should come from vegetables. At least. Ideally, it's going to be more than that. But at least 50% of whatever you eat. Because that it also contains fiber that's going to feed your microbiome, and your bacterial flora is going to help you to enhance immunity and destroy cancer cells. Yes, actually, fiber digestion by our intestinal flora can produce substances like the butyric acid, which is a short-chain fatty acid that has a very good effect as an anti-cancer substance. Your gut will make it for you. All you have to do is feed your bacteria with fiber, with vegetables, with things like this. If you're going to snack, Snack on cucumbers, snack on carrots, snack on jicama, snack on things that have a lot of fiber, and you can put a little bit of lime juice on them, and they're very good, they're very delicious, and you can do those things for your gut's sake. In turn, you're going to be helped in many other ways. Let me tell you something which is very important too. Many people tell me, doctor, but my father had lung cancer. And my grandfather had lung cancer. So I think I'm going to have it. So it's in my genes. Let's remember that what's in your genes is not printed on stone. It's not carved on granite. It is another risk factor. It's another condition that puts you on a higher risk than the average person. But doesn't mean that it is going to happen. Because if you have genes for diabetes, if you have genes for heart attack, if you have genes for lung cancer, there's something called epigenetics. What is epigenetics? Epigenetics is the possibility to suppress, to silence a bad gene. Yeah, I have that gene which is not very good, but I think I can suppress it. How? By enhancing, by exaggerating my lifestyle behavior. If I think I have this gene for lung cancer, I'm going to reduce the amount of animal protein. I'm going to increase more and more the vegetables, the fiber in my diet. I'm going to try to eat more raw products. I'm going to make changes in my life so I can beat the odds. Because not only I'm going to be silencing this gene, but I'm going to be making the good genes be able to express themselves through also the help of my intestinal flora, which is going to be very healthy. You see, everything is coordinated. So don't give yourself up just because it's in your genes. You have to work harder, but you can beat the odds. And then, what we have already mentioned. I had the bad luck, I had a cancer. Let's find about it as early as possible. When it's a tiny little group of cells that can either remove or kill fairly easy. I was telling you that only 1/4, 25% of people can detect a lung cancer when it's very easy, very simple, very inexpensive to treat it. The vast majority, when it's difficult, if not too late. You don't have to let that happen. So, surveillance, vigilance is the name of the game. We have a better lifestyle. We're going to do a lot of surveillance. We're going to talk to our doctors. And here is something that I want to remind you, particularly those in the younger generations. We have this idea that we go to the doctor when we're sick. And I have to apologize because doctors ourselves have put you in that position very frequently. I have seen people that go to the doctor, and you go to the doctor, and they say, but you're fine. You don't have to see me. Come on, go on with your life. Which means, come back when you're sick. I'm a total different type of a doctor. I'm the opposite. I'm the BioCare doctor. And that's what I'm proposing to you. You have to become the chairman. You have to become the CEO. You have to be the man at the helm in your healthcare, in your BioCare. You have to review everything and say, I do not want to fall prey to these diseases, and if I do, I want to catch them as early as possible. How am I going to do that? Educate yourself. Learn about it. Read about it. Please follow me. I beg you to follow me, to get more and more education and to know more about it. And if you have any question, whatever it is, as silly as it might be, you have the possibility of contacting me. You have a toll-free number. You have the website. You have the social media of your choice, etc. But ask a question. Doctor, I'm wondering about whether I should do this or that, whether this should help or not. What else can I add to my program? I'll be very happy to have an open conversation with each and every one of you, because that's my quest in this part of my life. Don't go anywhere. Let's talk about what once we really have lung cancer. We are talking about lung cancer. And you have this conversation with Dr. Rodrigo Rodriguez, the medical director of BioCare Hospital. And we're talking about this deadly disease that has a huge impact in Americans' health and death toll, because a lot of people die of it. A lot of people contract the disease. And sometimes we have a little bit of despair, like, I have cancer. What am I going to do? I'm going to do whatever I can. I'm going to be very depressed. I'm going to go down. Life will never be the same. Things will change. And I have just to brace myself ready to go. There's a lot of dismay. There's a lot of lack of drive to do anything. Most people will really go down. I have always wondered what goes through your head when they tell you you have cancer. And to be able to handle this a lot better, it's good that we think about it. This is like death. Sometimes we say, what's going to happen when I die? We don't think about it very often, but I think we should. That's why you do a will. You do certain things to make sure that whenever you're gone, some things will happen the way you intended to. And the same happens with health. If we think, what if I have this disease? What if I have cancer? It's going to be a lot easier to take a route, to make decisions, to choose what you can do, because there's a lot of options that you're going to have before you, that you can discuss with your doctor. You're going to have to sit and have an open conversation. But the most important thing is that you can make the difference between a good result and an undesirable result. I was telling you already, for example, that if we catch the cancer early, we have 60% chances of beating it, but when you discover it late, which is more than half of the people, you only have 7% of making the 5-year. So that tells you that, yes, if I'm aware of it, if I'm vigilant, if I do my work, I'm going to be able to catch it early and have better results, shorter period of treatment, less expense, etc. So yes, you have a very important part of responsibility. Once again, you're the chairman of the board, you're the CEO, you are the man at the helm. So But now I have cancer. And they're telling me this is the situation where I am. And the worst you can do is give up at that point. That's the worst part you can do. If you just give up and you say, okay, this is it, I'm gone, that's the worst you can do. Because there are many things that are within your reach that you have to get in motion. First of all, you have to stay steady, to hang on, to learn that you have to have a very important mental attitude. And the best one is, I'm going to do my best and I'm going to beat the odds. Because that is possible. I have many years, I have over 50 years as a doctor, seeing people with cancer. And you know who are the people that are really with the victory in hand? The person that had the good mental attitude. You do not panic, you do not give up, you look at what possibilities you have before you and you get them in action. And you're ready to make changes. If you didn't take care of your diet, well, you can start taking care of your diet today. I have had many people that had a very faulty lifestyle, and when they found out they had a cancer, they started changing everything, changing the diet, dropping stress, etc., and they started becoming stronger and stronger and beating the disease. Let me give you a quick story. I was on a plane from a beach in Mexico, in southern Mexico, nice beach, flying to San Diego, California. And the man next to me, I'm not the type of people that's going to talk to other people on an airplane. So this man asked me, what do you do for a living? And I didn't want to say I was a doctor. I just said, well, I'm related to medicines. That was my short answer. And then he asked me, what would you do if somebody tells you that you have a cancer and 3 months to live? I said, I don't know. 3 months to live? I'll probably come to this beach and spend the 3 months on the beach. And he told me, well, let me tell you, it doesn't work. They told me I had cancer, that I had only 3 months to live. I sold everything, I left everything, took my resources, went to this beach, rented a very nice house on the beach, and just relaxed. Started eating fresh, started eating good things, and just waiting. He says, I'm flying back because I have to get a job. That was 5 years ago, and I didn't die. He dropped all the stress off his back. And many times we have to do that. That's the rule number one. Get rid of all the stress. Get on your feet. Stand up. Stand straight. So you can face the problem. The other big problem I see with cancer patients, well, nothing that I do is important now. Cigarette smoking. Why should I quit smoking? I already got cancer. It doesn't make a difference. Yes, it does. Statistics show that smokers with lung cancer that quit smoking after diagnosis do better, live longer than people that continue to smoke. Make no mistake, every puff works against you. Why? Because cigarette smoke is highly inflammatory. Inflammation is what feeds your cancer. Inflammation is what makes your cancer cells grow and thrive and be happy, because you produce the environment where cancer can grow, which is inflammation. You continue to smoke, you are helping every cancer cell in your body. When you stop smoking, inflammation is going to go down. When you change your diet, inflammation is going to go down. When you get rid of stress, inflammation is going to go down. And the less inflammation, the better your body is going to work. The better your immune system is going to be able to attack the cancer. The better the medications and treatments your doctors are giving you are going to work. They are expensive. Use them well. Don't boycott your own treatment by getting a higher inflammation level, by being stressed, by eating garbage, or by continue to smoke. If you start following those rules, you are helping a lot. There are studies that show, that prove that when inflammation is defeated, cancer therapy becomes a lot more effective. That the same studies show that when inflammation in your body is rampant, your possibility of developing a cancer goes way up. So when we think inflammation, we think cancer. And when we think inflammation, we think lifestyle. Refined sugar, refined flour, vegetable oils, bad foods, fast foods, junk foods, preserved foods. Preserved, by preservation, I don't mean fermentation like sauerkraut. I mean a can, a box, a foil. So all those things, if we start putting all together, once the doctor tells me I have cancer, and I say, okay, stop smoking, change my lifestyle, I'm going to call Dr. Rodriguez because it's a free call, and because I know he's not going to charge me anything for advice. Call me and tell me, doctor, what can I do? And the first thing I'm going to tell you, open up your pantry and throw to the garbage you have in your pantry. Because I have opened a lot of pantries when I travel, when I visit people, and I see, if this is garbage, why you put it in the pantry? It should be in the garbage can. And if you start doing all those things, you're going to see how you're taking control. You're beginning to take control of your life, of your health management. Your doctors are very important, but you are the chairman of the board. You need information. You have them to support you, not to tell you you have this and this and read you something you could have read yourself, like a blood report. No, you have to explain me. You have to tell me. Because that way, I'm going to be the man in control. And the more you take that attitude, the better off you're going to be. I have seen people who were diagnosed with cancer that all of a sudden start looking a lot better, losing weight, becoming fitter and trimmer, and just look good. And that reflects in the way your body is going to attack the cancer, and that reflects on the possible success of whatever your doctors are offering you. The important thing is to put the two things together. And we're going to talk about that in the next and final segment. So please, don't go anywhere. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital and Wellness Center. And I'm very glad, I'm actually grateful that you're watching this podcast, and hope that the word is going to produce some resonance within you, and is going to let you think and reflect on things we can do in managing deadly diseases. Because unfortunately, in our modern world, when we thought medicine had conquered everything that threatened our lives, like tuberculosis or gangrene or things like that, well, we just were replacing one sort of a disease, which was infectious, by another type of disease, which is a degenerative disease. And today we're talking about cancer, and we're talking specifically about lung cancer. And my dismay or my worry is that all these new diseases are self-inflicted. When we had tuberculosis or when we lived through the COVID-19, there was little we could do. We could wear a mask, we could separate ourselves, we could isolate, etc. But there was a bug, there was a virus, there was a microbe that was looking to attack us. But when you talk about of all the modern diseases, of all the degenerative diseases, that's going to kill 7 out of every 10 Americans. 7 out of 10 are going to die because of that. You say, but these diseases didn't have to exist in the first place. If we ate right, if we didn't smoke, if we did a little bit more of exercise, and just loved ourselves a little bit more, we could be a very healthy nation. But we're seeing more and more sick people, and we're seeing many people younger and younger being affected by the same type of a problem. So we have to rethink what we do. I started as a doctor 50 years ago, more than 50 actually. And I always felt, going through medical school, that we were missing something. That a lot of things that I heard at home from my father, he was an accountant, he wasn't a doctor. But he was very conscientious, very instinctive about how to feed the children, he said. And that came from his mother. My grandmother was very careful too. She would line all the grandchildren up once a week and gave us cod liver oil. And she always gave us a small lecture about what we should eat during the week and what we should not eat. And that was a weekly conference accompanied by cod liver oil and a little bit of orange juice afterwards, or half a lime to suck in it. And when I was growing up as a doctor, I saw a lot of those teachings that were not there. Used to be, I remember, when I was a kid and my mother would take me to the doctor, my mother would ask, and what is the diet? And the doctor would say, well, you cannot do pork. I don't know why, but he said always no pork, no fats, no this, no the other. You have to. He always gave a little bit of a lesson of what we should eat when we were ill. And when I was growing up as a doctor at the university, I asked my teachers many times, but doctor, what about the diet for this disease? Let's say we're talking about an infectious disease. I would say, what's the... Oh, no, they can eat just about everything. And you probably have gone through the same experience. You go to the doctor and you ask the doctor, and you say, what should I eat? And the doctor tells you, well, whatever you want. Don't overeat. He's going to make a little remark, but not going to be very specific. So I saw that we were missing that we were missing bed rest, that we were missing a lot of things that are important, that we were missing enemas. Come on, enemas are in the United States pharmacopoeia up to the middle of the last century. So when I was growing up, enemas were very common. And when I went to medical school, we still talk about enemas. When I finished medical school, I never saw them again. And they came from instinct. But at the same time, at the university, I was learning a lot of good things. I was learning about the use of medication that was very favorable, very good, about surgical procedures that were short of a miracle, about different manipulations that could make a big change in the outcome of a treatment. Then I finished medical school and I started working as a doctor and seeing patients, and I thought, why don't I put the two things together? Why don't I see a patient that has a disease and change their diet, their lifestyle, start doing cleansing enemas, starting doing work with the intestinal flora, etc. Why don't I put it all together? And you know what? I couldn't do it. Because if I went to the hospital and I told the hospital that I wanted this or that type of a diet for a patient, let alone a 24-hour fast with only liquids and tea and so forth, people would faint. You're talking about what? A diet? There was a diet for diabetics, there was a diet for certain, but in a hospital you cannot say, I want good food, period. I want fresh food. Things like that. So it came to the point where we thought, this is me and a group of other people around me, we thought we need to have our own hospital. And that's where BioCare Hospital was born. A hospital that has a kitchen that has 7 times the size and twice the staff of our pharmacy. Because we needed good food. Thy food will be thy medicine. That's what they said, and that's what it is. So I wanted to complement all these things, to integrate. Yes, I can do surgery. Yes, I could follow a treatment. Yes, I could do a lot of things. But I have to support the body. I have to support the host of the disease. Because, number one, I understand that we were created in perfection. Number two, I have to understand that my body has a lot of defenses and resilience. Number three, I know that my body can fight off the disease by itself. It doesn't need anything else. If I can help him, fine, but you don't need that necessarily. But when you put the two together, then is when you start making the changes. And that's what we do. And I was telling you that inflammation is the environment where cancers are created and where cancers thrive. So if I change your food, if I cleanse your colon, if I rebuild your intestinal flora, if I help you with all of that, my cancer medication is going to be a lot more effective. If I help my immune system to be more active or to enhance the production of cells, I can be more effective. So BioCare is a center where we are going to integrate all this for the patient's benefit. Because it doesn't cost me anything that if I do a medical procedure and when dinner comes, I give good food. This good food is not going to do anything to block my treatment. Contrary, it's going to enhance the efficiency of my treatment. But I guess talking about food is very low for a doctor that lives in an ivory tower. But we have to start thinking in that direction. We have to start creating centers where we're going to work with a patient all around. And we have to make sure that everything is going to happen in the right direction. Because I trust that that body that I'm handling was created in perfection and has a lot of resources that I have just to be able to set in motion. And that's going to happen when I remove the stress, when I remove the toxics of tobacco, when I remove the toxics of alcohol, when I give that body the vitamins, the minerals, the nutrition, the quality of food it needs, when I enhance the immune system through the creation of a very healthy intestinal flora. That's not only going to help my immunity, but it's going to have substances that can act against the cancer. You see? So it is not just, well, this is another cancer hospital. I think that if you read everything quietly and peacefully, you're going to understand a lot of things. But you don't even have to do that. All I'm asking you to do is to educate yourself, to know what you're dealing with, to know what are all your options and where you yourself, with your own hands, can change the environment in which you live and in which you are being treated. You yourself. Here's my hand. Just give me a call. Send me a message. I'm here to help you and to answer any doubt, any question, any comment you might have. Till next time, I'm Dr. Rodrigo Rodriguez from BioCare Hospital.